So the first thing I'm going to do is make sure I have my BSI on. I'm going to come in and I'm going to evaluate the scene, make sure that the scene is safe. I'm going to look at the mechanism of injury. It looks like she maybe fell off of a chair and onto the ground. I'm going to go ahead and request additional EMS assistance. At this point, I'm going to now consider C-spine. I'm going to have her move to a midline position and hold her C-spine. My partner's going to take over that. I'm going to now determine the level of consciousness. Ma'am, are you okay? So it looks like she's unresponsive. Chief complaint looks like it's possibly a head injury. The first thing I'm going to do is look at her airway. What does her airway look like?
It's clear and patent.
Clear and patent, okay? I'm going to go ahead and open using a modified jaw thrust. How's she breathing?
Irregular with periods of apnea.
Irregular with periods of apnea. Okay, I'm going to go ahead and have my partner get a BVM and assist with the BVM. So, the next thing I'm going to do is look at her circulation. I'm going to feel a carotid pulse.
Pulse is present in carotid and radials.
And her skin color.
Appropriate color and warm, dry to the touch.
Okay, I notice that I have some bleeding up here on her head. I'm going to go ahead and hold a gauze pad with pressure on her head. And I'm going to put her in shock position. The next thing I'm going to do is do a quick assessment, looking for immediate injuries or extra bleeding. Quick glove checks. I'm going to go ahead and go down her chest. Nothing noted. I'm going to go ahead and make a quick transport decision. We want to get her moved onto a backboard and get her loaded into the ambulance as soon as possible. So the next thing that I'm going to do is I'm going to do my head-to-toe assessment. Before I do my head-to-toe assessment, I'm going to go ahead and check for sample history. Because she is unresponsive, I won't be able to do a sample history. On my head-to-toe, I'm going to go ahead and look at her head, make sure there's no deformities, crepitus, abrasions, punctures. I'm going to look at both ears, make sure that there's no bleeding. I could do a halo test on both. The next thing I'm going to do is going to get my bag. And we're going to look in her eyes. What's her pupillary response? All right. Now we're going to go ahead and look at her jaw, make sure that there's nothing else. We're going to reassess her mouth and her airway. I'm going to look for JVD or tracheal deviation, which I see none, and I'm going to check her cervical spine. I'm then going to reassess her chest. I would expose. I would also at this point in time grab a hold of my stethoscope and listen to lung sounds. So,
lung sounds clear and present.
all right. Good. Do I see any sort of injuries to her body when I expose her?
No.
Okay. I'm going to go and feel her belly. Okay. And do a quick blood check. I'm then going to push down on her hips and push in. Any deformities noted?
None.
Okay. I'm going to go ahead and do opposing pressures, and I'm going to check her genitalia. Make sure that there's no bleeding or abnormalities. I'm going to go ahead and press, opposing pressures, looking for any deformities, crepitus, abrasions, punctures, tenderness, lacerations. I'm going to feel a pulse. Do I have bilateral pulses?
Yes. Normal rate.
Okay. And I'm going to go ahead and check her upper extremities. Make sure there's no bleeding or deformities. Do I have radial pulses?
Yes. Normal rate.
Same thing here.
Yes. Normal rate.
Okay. All right. So now we're going to roll her onto a backboard, and we'll go ahead and check her posterior, including her buttocks as well as her back, go all the way down her back. Would you like me to put her on a backboard?
No.
Okay. So just make note that I would check those throughout. So the next thing I'm going to do is take vital signs. I'm going to go ahead and put this on. (110/76) is what I get.
You're showing 124/90.
Okay. I'm going to go ahead and feel her pulse. What's her pulse?
90, regular at the radials.
90 regular at the radial. And her breathing currently?
24, irregular with periods of apnea.
Okay. Is she still assisted?
Yes.
Okay. So now I would just give a report to the EMS and continually check on reassessing her injuries, make sure that her her bleeding is controlled and there's no other injuries. And looking for any secondary injuries.